Welcome back to CTV Morning Live. As many of you know, it is Breast Cancer Awareness Month. We're bringing you information. We've been talking to you about lots of different fundraisers that are happening. We are stretching out a little bit more into the outer regions, and joining us from the Renfrew Victoria Hospital, Cece Whalen, great to have you here, and also from their diagnostic imaging team, Debbie Tierney. Okay, there's a lot going on right now as the hospital's moving into this digital imaging, and for the community to get on board, there's a real call to action, Cece.
Absolutely.
Give me a quick rundown as to what you're hoping to do with this.
Well, the call to action, the implementation of the digital mammography is a way to the hospitals taking that a step further and reaching out to the community, especially women, to try and empower them to learn, to know, and to act. So we want the women to be able to get involved and pay it forward. That's the main purpose that we really want to see people get involved. We have to take action for a small community hospital.
Absolutely. It's a smaller hospital, but to be able to get the word out in terms of understanding when testing needs to be done, what it's going to be like, how to get involved, and how to share some of this information.
Absolutely. So we've used mail-out flyers, have gone out to the community already, and the hospital is going to invest in teaching women who are volunteering and getting out there, so we can go, if you have a women's institute that you want to come out and talk about digital mammography, then call Barb Deslitz at the hospital and we'll make arrangements and get that out there.
So this is the start of the call to action, and Debbie, for you, this is something that you deal with on a daily basis. You're the one that's actually there implementing the tests, being there with the women. What will the change to digital mean for you, for the hospital, for the patients?
Well, the digital mammography is going to increase our workload. We'll be able to see images far quicker than we do now. We are presently using a film system where we have to process, and the films are stored, so we have to use a lot more space to store. With the digital, we'll be able to put it on a PAC system, which will go on disk, or will be able to be viewed by specialists that are in outreaching areas.
Sending them out to patients, seeing specialists even into the Ottawa area. What are some of the statistics that we're dealing with, and so that women really understand the importance of understanding what's happening?
Presently, we do 1,700 Ontario breast screening clients a year. We do 900 diagnostic workup clients. Those are ladies from 40 up. Some are men. Some are recalls that have to be worked up for magnification and cone compression views. And then we have stereotactic core biopsy patients. That's where we found an abnormality in the breast, and we have to biopsy in order to find out what the pathology is.
It's constantly keeping on top of things, and it's our responsibility as women to keep on top of things. So in terms of when we should start to, in our minds, say this is when we need to start getting screened, this is when we start to need to book some of these appointments, what age group are we looking at?
I would start screening about 40. The Ontario Breast Screening Program wants you to start at 50 to 75. It's sponsored by the Ontario government. I would say if you have a positive family history that you should start screening at least a few years before the relative has been diagnosed with breast cancer. I also feel that breast screening or breast self-examination should be taught to everyone, maybe as early as high school age, and that way you know your body. You can feel when something's wrong, so that you can go to the doctor about anything.
So this is the education, and this is what you guys are really trying to do. For people looking for more information on this call to action program, where can they go?
Well, they can go to, I think, the Renfrew Hospital website. As well, they could call Barb Deslitz in the Foundation office at extension 263. And, I mean, I'm available if anybody has any questions. Feel free to ask me. If I don't know the answer, we'll find it out.
You'll find out. And it's interesting that you have to do this in a smaller community, be able to get in and to be able to get the answers out, which is great.
We really need to get the money out there, and we don't have corporate money.
No, let's talk about fundraising. Yeah, that's
right.
Always a great issue right there. Ladies, thank you so much for sharing some of this information, and best of luck as you change over into this imaging system. We do have to take a short commercial break. We're approaching top of the hour. Your 8 o'clock news headlines coming your way right after this.